I'm happy to say that CAMH will now have the opportunity to animate our hope in a way that we've only secretly imagined. So it's with the deepest gratitude and humility that I'm delighted to announce a gift that will bring hope to light and to life. An anonymous philanthropist has entrusted CAMH with a $100 million donation. $100 million.
As we told you earlier, and as you just saw, the biggest donation ever made for mental health research was announced today. An anonymous donor is giving $100 million to CAMH for research. One man who has struggled with mental illness most of his life was at that announcement, and he spoke about what research has done for him.
Clinical research has changed my life. I'm a person whose story could easily have been tragic, whose life could easily have been much shorter.
Like so many other Canadians, Tom Churchill has suffered from depression. He struggled with it for most of his adult life, but he credits mental health research for changing that reality.
After a half-century of dealing with depression, I was offered a treatment here at CAMH that resulted in complete remission of depressive symptoms, a treatment that was made possible only because of advances in clinical research.
And this is what his treatment looks like. It's called repetitive transcranial magnetic stimulation.
Repetitive transcranial magnetic stimulation uses very fast magnetic field pulses to stimulate areas of the brain. This is the device that delivers the treatment.
The treatment has been around since the mid-90s. Despite the fact it's effective in about a third of the patients, it's not well used. It's expensive and takes time.
So it's placed over the skull, it's placed in the frontal areas of the brain. Those are usually the areas that are involved in depression. Part of the research that we've done here in Toronto and in Vancouver in a big, large study is trying to see whether or not we can deliver the treatment in a more efficient way. So we've studied bringing the treatment time down to about 3 minutes compared to about 37.5 minutes. What that means is the number of people that could be treated in a day could be greatly increased.
Is there so much more to learn about the brain and mental health issues?
Absolutely. The brain is a very complex organ. It's more complex than any other organ in the body, and we're still learning about how the brain works. So in order for us to be able to treat people better, we really need to understand how the brain works and why it doesn't work properly, or why people get mentally ill.
For Tom Churchill, what has been learned so far has given him a new life.
RTMS, or repetitive transcranial magnetic stimulation, has given me the chance to experience life in a way that I can only assume people who do not have depression experience it.
Mental illness is also tied to the growing homeless issue in this city. Mayor John Tory had an emergency meeting with the province to discuss the issue this week. And one of the biggest challenges is the lack of resources. Wait times for counseling and therapy in this province can be 6 months to a year.